If you've ever felt like prednisone was messing with your mind, makes you feel like you're going crazy, leaving you anxious, irritable, or just not feeling like yourself, you're not alone. Mood changes are some of prednisone's most challenging side effects, and they can sometimes feel overwhelming or even scary. Welcome to part 1 of my Prednisone Mood Changes Marathon. I'm Dr. Megan, the Prednisone Pharmacist, and I'm a board-certified doctor of pharmacy, third-generation pharmacist, and former prednisone patient. Over the past 7 years, I've created more than 1,000 videos to help people just like you navigate the complex challenges of taking prednisone. In this first part of the marathon, we're focused on understanding what prednisone is doing to your mind. You'll learn why prednisone causes anxiety, depression, or just simple mood swings, what steroid-induced psychosis is and how it happens, whether roid rage and other myths about prednisone are true, and how prednisone can physically impact your brain. This is the foundation for everything that I'm going to cover in part 2, where I'll share coping strategies and real-life stories from people who've been through it. Be sure to check out the timestamps in the description to jump to specific sections if you need to. And one quick note, some of these videos are from way earlier in my creator journey, and I've tried to optimize and get better at audio and video and communication styles, so I hope you forgive those earlier iterations. Now, let's dive into what prednisone is doing to your mind and emotions. First of all, we'll talk about who is affected by prednisone side effects. Next, we'll talk about what you can actually expect if you're taking prednisone, as far as how it's going to affect your personality and your mood. And finally, we'll talk about how you can cope with it. You'll notice the references there. I based all of this on evidence that is published in the medical literature. These are 2 reviews of medical literature that I'm going to summarize and simplify for you today. First of all, this quote is directly from one of those articles. It says, educating patients about possible side effects and the need to report them is essential. And I couldn't agree more. That really is my goal as a prednisone pharmacist, to educate people about prednisone and how it is bothering them and what they can actually do about it. In that same article, they told this story, and I just wanted to share it with you really quick. It says, 3 days after starting high-dose prednisone, a patient, a 50-year-old married white woman, began experiencing depression, intense fatigue, malaise, weight gain, and swelling of her lower extremities. She felt higher than a kite. She was unable to sleep, lacked impulse control, and was inappropriately humorous. That would have been interesting. Her mind was flooded with unrelated thoughts, and her thinking became so disorganized she couldn't even drive. She had memory problems and required multiple reminders, including pinning it to her clothes so that she wouldn't forget her responsibilities and appointments. Her doctor had told her, "You might become hyperactive," but she was not prepared for the magnitude and extent of the changes she experienced during her taking prednisone, nor for when she had to go back on prednisone again later, what kind of depression she would have during the first taper period and in other treatment cycles. When her depression became so bad, she sought help from a psychiatrist. Even after stopping prednisone, she continues to report memory problems, some loss of cognitive clarity, and vulnerability to overreacting to stress. Does any of that sound familiar to you? It sure does to me. For me, my personal experience was my doctor in the hospital said, "All right, you're a pharmacist. You know this drug is probably going to cause insomnia. You choose which medicine you want us to give you for your insomnia." Okay, cool. So they let me prescribe my own, basically, with his signature. Well, let's learn about when does this happen. So, is it in your head? Are you going crazy, or is it the drug? That's the question we're answering. And if you follow what I'm about to explain, you'll find the answer. First of all, more than half of people who take prednisone report a mood condition. We'll explain more about what those are later. For people taking prednisone, there's a lifetime risk of 60% chance that you'll have a mood or anxiety disorder while taking prednisone. For serious side effects, 15.7 out of 100 person years. So if one person takes a medicine for 1 year, that's one person year. So 15 of those out of 100 will have serious, severe depression or even possibly commit suicide, with a 5.7% chance of having severe side effects. And how many people are even taking prednisone anyway? Well, there's a lot of confusion about it. The lowest estimate is that 0.9%. We'll just round that up to say 1% of the population of the United States of America is taking prednisone at any time. And in 2018, it was the 31st most commonly prescribed drug, behind thyroid medicines and blood pressure medicines and a few antibiotics. It was number 31. There were 23.2 million prescriptions in 2018. And how bad is it anyway? Well, 7% of people taking prednisone are hospitalized for psychiatric side effects. And how many people could possibly be affected by psychiatric side effects? Well, the range could be 1.8% to 57%. That's how broad it could be in the literature. Or maybe 13 to 62%. But let's just settle on 27%. That's the middle most best estimate. So the real answer here is this drug causes serious psychiatric side effects that you need to be aware of so that you can have a plan to deal with it. What side effects are they? So we'll start on the left. First of all is mood lability. Now, what in the world does that mean? So to have a labile mood, it means that you jump way more quickly between moods than is normal for you or for most people. Basically, you are more likely to be happy and then suddenly be in tears, or to be enjoying time with your children and then suddenly screaming at them, or to be just peacefully driving down the freeway and then suddenly about ready to cut somebody off or something worse. So that's a fairly common side effect. Then there's anxiety, which is restlessness or worry or fear and agitation. Insomnia can be related to that, and it's characterized by restlessness, waking up in the middle of the night and not being able to fall asleep because your mind is racing. And then depression. So you'll see that little down arrow. They call this a negative symptom. And basically you are lacking in energy, you're tired, or maybe you're not tired, maybe you just can't sleep. The very most extreme of this is suicidal. And it is more, I'll tell you more about that in a minute. Then there's memory impairments. So even though you're young taking prednisone, you might feel like, do I have Alzheimer's disease? Am I forgetting everything already? Do I have dementia? It might be distracting, so you won't be able to focus and complete a task as well as you normally could. And maybe even be confused and disoriented, not sure where you are. The next one is mania. So mania can range from something as simple as euphoria, just feeling really good and having extra energy, to hypomania when you might not even need sleep because there's so much pressure to just do, and you might be more irritable. And then pressured speech. Just I've got to talk really fast. Blah, blah, blah. I've got to just talk, get it out. And you're not normally a talkative person, but it's just got to come. And it comes really fast. Then psychosis. This is the most extreme and the most rare. It's not very likely that this will happen, but it does. They used to call it steroid psychosis because prednisone is a steroid. And it's characterized by delirium, like, where am I? What's going on? Hallucinations, seeing things that aren't there, disorganized thought, like jumping from topic to topic, and it doesn't make any sense why you're talking about one thing and then the next thing. And delusions, like thinking you're the president of the United States or something. So these are all possibilities when you're taking prednisone. So when do they happen? And this isn't true for everyone. This is just a huge generalization of what could possibly happen in the medical literature. So first you take the prednisone, and at the beginning, it's more likely that you'll feel that euphoria and extra energy and maybe even mania, all those positive symptoms. And then as time goes by, you might get anxiety or insomnia. And later on, when you've been taking it a while, it's more likely to have depression, and the mood lability could really be anytime. And when it's extreme, it could be psychosis and memory impairment. And finally, you could be suicidal. And I want to be really sensitive here. It's extremely rare. Only 0.03% of people who are on prednisone commit suicide. So don't get any ideas. You're worth it. It's worth fighting for whatever you're going through. Prednisone is miserable and awful, but there's a way to cope with it. So please preserve your life. This is really important, and I'm your advocate. Just message me on this page and I'll help you get through it. There are suicide hotlines. You are worth fighting for. I know it's easy to forget when the prednisone is making you feel different, but it's worth it. Okay, so back to that timing. You might be thinking, oh, I'm not going to experience depression until I've been on it a long time. No, that's not necessarily true. Or I'll only have euphoria at the beginning. It's possible, but not necessarily true either. So basically, prednisone side effects that are in the psychiatric realm can happen at any time. They could happen immediately. They could happen while you're taking it for a long time, or they could even happen when you've stopped taking it. So they did an experiment and to find out when people started feeling their mood change, their personality change, any complication in how they feel. And they found that 39% of people experienced some sort of a side effect within 1 week of starting prednisone. 62% of them within 2 weeks. And 83% of people who were going to experience a side effect that was from prednisone in affecting their psychiatric health, mental health, was within 6 weeks. The average median was 11.5 days. So it's likely if you're going to have it, that it's going to happen pretty quickly. But it might not happen until you completely stop taking it. Then another study, they showed that most people experienced their prednisone side effect within 1 week. So I can attest to that. I felt high as a kite like that woman. I had all this energy, and that was all at the beginning. And then I took prednisone for a really long time, and I had insomnia, and it was awful. And so that is one of the reasons I've become the prednisone pharmacist, to help other people cope with that. Can we predict who gets prednisone psychiatric side effects? Nope. They used to say that, oh, people who get side effects from prednisone that affect their mental health, it was just an exaggeration of their previous personality and mental health. And that's not true. That is not true at all. The truth is, you cannot predict it. Just because somebody might have depression before prednisone doesn't mean that it's going to get worse or change at all while on prednisone. Just because somebody has no mental illness before prednisone doesn't mean that they won't get it while on prednisone. There's no way to predict it. So even the dose doesn't predict it. You can't say, oh, well, you're on super high dose prednisone for a short time. Of course you're going to get side effects. You might not. You might be the lucky person who doesn't. We don't know. So then what about the dose? I said it's not predictive, but it is a risk factor. So you're more likely, but we can't predict who it will be. So let's talk about it. So a normal, and I'm not going to say low dose, but on this study it was low dose, less than 40 milligrams, 1% of the people had prednisone psychiatric side effects. Low dose is really like less than 7.5 milligrams. People who are on a high dose, which was more than 40 milligrams and less than 80 milligrams, 4.6% of people had a severe psychiatric side effect. And then at super high dose, we're talking 80 milligrams or more, 18.4% of people had a psychiatric side effect, and a severe one at that. So while you can't predict it, you are more likely to have a side effect the higher your dose. Now, what about gender? Is that predictive? Well, they found that it's more likely as a woman that you will experience a depressive side effect, and men are more likely to have mania or delirium. Then, what about the type of medicine? So prednisone is a corticosteroid, and there are a bunch of corticosteroids. Another one is dexamethasone, and that one's long-acting. I was actually put on that one as well for a very short period of time in an extremely high dose. And I really did feel depressed for the first time in my life. For like a week, I was just like, I can't get off the couch. I have no emotions. I am just depressed. And it was so weird. I'd never felt anything like it in my life. And then they got me on prednisone after that super high dose dexamethasone failed. Like I was taking 10 pills at once. 10 of the highest strength pills. So the long acting is more likely to cause depression than short acting. And what is short acting? Things like hydrocortisone. Okay, so what about age? So children who have to take prednisone, about 50% of them have a behavioral change, and they're more likely to have memory impairment, as are the elderly. Then what about people in their middle age? So if people are 18 to 30 years old, they're the most likely to get a panic disorder side effect. And the middle-aged people, 18 to 50, are the most likely to be suicidal and actually commit suicide, which is the same in the rest of the population as well. That's the most likely population that commits suicide in general, that age group. Finally, when prednisone is given to the elderly, especially those older than 80 years old, they're more likely to really get dementia and delirium and confusion and disorientation, just to have it really impact them and make them suddenly go from okay to acting old. So these are things to consider when your doctor is prescribing prednisone to see, well, what's the most likely thing that might happen. Since we can't predict who is going to have these side effects, there's no evidence that any of those things predicts it, then this message is for all doctors and for all of you to share with your doctors. This is straight from one of those articles. These are their words, not mine. They said, because we cannot predict, All patients should be considered at risk. So it's okay. You are just fine if you are experiencing these side effects, because all patients are considered at risk and should be monitored. So everyone who is being treated, everyone going through withdrawal from prednisone, and for some time afterward, it can cause side effects to your mental health. And the doctor and you, and if you're a caregiver, you should look for changes in your mood, in the memory, thinking abilities, and behavior. And if you do, then you're more likely to be able to catch it before it's too late so that you can make an impact. And next week, we'll talk about coping strategies based on evidence, what you can do to fight back against these side effects. What methods and medications have been shown to be helpful for people on prednisone. And a year ago, I was trying to take a nap, but because I was completely exhausted because prednisone had given me insomnia, and I still couldn't even take a nap because my mind was revved with that, like, not quite anxiety, but just buzz, like this constant buzz. I couldn't relax, couldn't settle down. My personality was different than I normally was. And I had this all going through my head, and I thought, people need help. What can I possibly do to help? What can I do to prevent this from happening to me? How can I deal with these side effects? And I had this bolt of lightning flash into my brain, and it said, you need to create a dietary supplement for people on prednisone. You need to fight back against those consequences, how miserable it is. And so I created Nutrinize Zone. It gives back the nutrients that prednisone is stealing. It has ingredients in it to help calm your mood, to help you get restful sleep. I selfishly created it for myself so that when I go on prednisone, I have a way to fight back. But I made enough to share so that you can get a hold of it yourself and you can fight back. You can go to nutrinize.com and that's where you can buy it. And if you're not ready to buy it, please go to my page, and it's facebook.com/Nutrinize, and like my page so that you can find out more about Nutrinize Zone and hear about upcoming events and promotions that we've got going on. I am so excited to share this with you because it is like a fulfillment of a dream to be able to say, look, I created this and I created it for you because I know it helps. So check it out at nutrinize.com. What do you do when you're dealing with the side effects of prednisone that affect your mood? How do you deal with roid rage? What do you do when the medicine makes you so depressed you don't want to get out of bed? That's what we're going to cover today. We're going to talk about how to cope with the psychiatric side effects of prednisone. So, first of all, we'll talk about the non-prescription strategies, things you can do without getting a prescription from your doctor. Next, we'll talk about examples that worked for me of those non-prescription methods. And finally, we'll conclude with what you can ask your doctor about getting as far as prescription options. And this is based on not only my own experience as a prednisone patient, but also these articles, medical reviews, and my expertise as a pharmacist. And if you haven't already caught last week's episode, we did the prequel to this. This is the second episode about psychiatric side effects. So if you're curious about any of the side effects I'm about to talk about, if you check out last week's, then you will understand more of what we're talking about. Okay. So What happens when your prescription for prednisone makes you feel so crazy you want to jump off a bridge or run across a busy street or spend all your money or some other really bad side effect that is really worse than the reason you're taking prednisone? So when we talk about prednisone, it's always a risk versus a benefit. The risk being the side effects and the benefit being your disease being under control. So if you're taking it for something that is just to make you feel better and not necessarily life or death, then when you have a really bad side effect, it's not worth it anymore. But if you're taking prednisone because your kidneys are going to fail, or for me, I could have bled to death, then it might be worth it. And so we'll have to talk through different scenarios. So this scenario, the first scenario we're talking about is if there's any other possible treatment we could use that would keep you alive, then if you have a bad enough psychiatric side effect, then the goal is to stop taking prednisone and to slowly taper it and to be watched while you're tapering, to not ever go cold turkey. And if that doesn't work, then decreasing the dose. So for example, if you're on 40 milligrams, going down to 20 milligrams. Then the second line options are these non-prescription coping strategies and then prescription coping strategies. So this is the same chart I showed you last week. Each of these little dots is a psychiatric symptom that you might feel. So first of all, we'll talk about mood lability. And a non-prescription way to cope with this, and pretty much any other of these, is meditation. It can help no matter which of these symptoms you're experiencing. Meditation is a practice. So it's something that you have to do every day, and you get better as time goes on. I'll talk about that more in detail in a little bit. Anxiety. So if prednisone is giving you anxiety, which is pretty common, you can learn breathing techniques. One that I learned that I found really helpful is called the 4-6-7, where you breathe in on 4, 1, 2, 3, 4, hold it for 6, 1, 2, 3, 4, 5, 6, and then out for 7, 2, 3, 4, 5, 6, 7. And then you repeat in, hold, out. In, hold, out. And then there's the box technique, which is in for, hold it for 4, out for 4, hold it for 4, in for 4, and you just draw a box with your fingers. And it distracts your brain from thinking about whatever you are anxious about, and it calms your heart rate. And this is great to use with kids too, because it gives them something else to focus on. Insomnia. So this is also quite common. The number one complaint that people tweet about when it comes to prednisone is insomnia. So if you're experiencing restless sleep, then it's pretty common. Don't feel alone. One thing that really helped me was improving my bedtime routine. And one definite big change I made was no screen time before bedtime, because that prednisone brain would just go through whatever I had just seen online, whether it was politics or a friend from high school or some random recipe, and it would just go round and around and around in my brain all night long. And so I learned I had to stop using my screens at least 2 hours before bedtime, and that really helped calm my brain down. And then I've done another episode about this. It was one of the first ones I did about sleep, so you should check that out, and it's in depth with some really good tips. Okay, depression. So depression is more common at higher doses and when you've been on it a longer time. And one of the most helpful things for depression is exercise. And if you're taking prednisone for a joint problem or a breathing problem, then I can understand how exercise is definitely going to be a challenge. But there are exercises for every level of ability, for every impairment level. And I encourage you to find one that works for you. I really am loving the 7 app doing high intensity interval training. So I use that all the time. It's free. You do 7 minutes of workout and you're done. And I feel so good after. Okay, memory. A lot of people get brain fog or even dementia when they're taking prednisone. And so doing puzzles and doing as much active things with your brain as possible. Writing, reading, just focusing as much as you possibly can. Mania. So if you're getting this, like I got probably hypomania when I started prednisone. I just had like a ton of energy. I could just go. So if you have that, try to tell yourself to focus it. To focus that energy to do good things like meal prepping, like going grocery shopping for healthy foods so that your food in your house is good for eating when you get the prednisone binging. So the last time I was on a prednisone drug, I prepped like for 4 hours and I had tons of delicious great food to eat. So I'd highly encourage you to use that if you get that. Psychosis, so people literally feel crazy. Electroconvulsive therapy can help, but that technically is a prescription. So these are some things that I found helpful. For anxiety and insomnia, doing meditation. So there's an app called the Calm app. I believe there's also one called Headspace, and these would get me through some rough nights. So if it was 2:00 in the morning and I was like, my eyes won't shut, my brain won't turn off, what am I going to do? I would put in a little earbud and I would listen to a calm meditation, sleep story, whatever. Another thing I would do is listen to scriptures on the audio, just things that would help me turn off my brain and think about something more calming. It was really helpful for me. Okay, so relationships are definitely affected by your prednisone mood changes. You might feel like a different person. Your family members might feel like, where did mom go? What happened to dad? Like, why isn't he acting the same as he used to? Or why isn't mom as nice as she used to? Why can't mom get off the couch, right? So we have to help our families know that this is the drug and not us. I know it's hard for everybody to remember when it's the heat of the moment. Some things as far as parenting that helped me there's a lot of really good parenting books out there. And then I was actually taking this AHA parenting course while I was on prednisone, and it really helped me to not yell at my kids. We'll just leave it like that. To really connect, to make connections with my children. And so I really recommend that. Then as far as marriage, there are some really good marriage books. John Gottman is probably like the foremost marriage expert in the world. And he wrote this book that I think everyone should read. It's relevant whether you're married or not. Whatever relationships you're in, this one, it just tells you what not to do and what to do and really makes it doable. So the 7 principles for making marriage work. One of the important principles in here is the 4 horsemen of the apocalypse / of like predicting divorce: criticism, defensiveness, contempt, and stonewalling. And I understand when on prednisone how easy it is to default to these options, but we need to find alternatives. And so in the blue, you can see the terms that they use in this book. And so if those terms don't make sense to you, you definitely need to read that book. It's really good. And I love the bottom one. It's do physiological self-soothing. So just breathing deeply and turning down that hyper reactive state that we're in when we're on prednisone. Just doing anything you can to slow it down, to relax, just to breathe. And you cannot be in that reactive state and blocking the people that you need in your life to care for you. So check that book out. Okay. Back to this little chart of our main psychological symptoms. So first of all, mood lability. So that going up and down with your moods. You can do talk therapy. And if your mood lability gets so bad that it turns into delirium, some drugs called haloperidol is the first generation antipsychotic. And then atypical antipsychotics, new ones like Abilify or Zyprexa. Those ones can help. Anxiety. So there are a lot of medicines that can help with anxiety. Some things like Zoloft and Prozac and Wellbutrin. And then if you need something that's shorter acting and you don't get the anxiety all the time, it's just once in a while, then you could do something like Xanax. But that's more addictive and you don't necessarily want to get on something addictive. Insomnia. So first line therapy for most people who have insomnia would be to take melatonin. And this is especially helpful when you are taking prednisone because prednisone is interfering with your circadian rhythm, and melatonin is your circadian rhythm maker. And so it's just giving back what prednisone is blocking. And then if that's not enough, and I would start out at 1 to 3 milligrams per day, and you could even go up to 20 milligrams, but I would go really slowly to get to that point. Then Benadryl is an option, over-the-counter diphenhydramine, like Tylenol PM. Those things all have that diphenhydramine in it, and that's it's actually an antihistamine that makes it so you're not feeling allergic, but it can also have the side effect of making you feel drowsy. And so most people this can be helpful in, but some people who shouldn't use it are people who are over 65 or people who've tried it in the past and have the opposite reaction of like being hyper instead of drowsy. And finally, there are sleep medicines like Ambien and Lunesta. Those drugs are really great at helping you fall asleep, not necessarily keeping you asleep unless you get the extended release version. And they are also not very safe in the elderly. So be careful with all of these options. Always do your homework and make sure that it's really right for you. But if you're experiencing these things, sleep is one of the most important ways to heal from anything. And so sleep is important. It might be worth it to take medicine for it. Depression. Okay, so Zoloft is also good for depression. And Prozac and Paxil, all of those drugs are SSRIs. They can help with depression. And then lithium. So this is an ion that can help to stabilize your brain activity. And so it not only helps with depression, like major depression, but it'll help with some of these other side effects coming up. And then one more thing that's not on here, it's called tricyclic antidepressants. And they've been shown to not really be as helpful for this type of prednisone causing depression. So I would stay away from those unless they already work for you. Okay, memory. So if prednisone is interfering with your memory, there are memory medicines like for people who have dementia, like Namenda, and that can be helpful. Then there's this seizure medicine called Lamictal, and it's actually used for a lot more things than just seizures. And so it can help to clear the brain fog and remember a little bit better. And then even this blood pressure medicine called propranolol can help. For mania, when you're high as a kite and buzzing, these are called mood stabilizers. Instead of just having your mood way up high, it just kind of settles your mood down, keeps you more in the normal range. So lithium, that ion, olanzapine, and other atypical antipsychotics like Abilify. And then Phenytoin and valproic acid are both seizure medicines, but are also often used to help with mood regulation. So if you're having these problems, it's probably worth it to be on these medicines. All right, psychosis. They used to have a term for all of these called steroid psychosis. And back in the day, a lot of these medicines didn't exist, but prednisone did. And so they didn't have many options. Thankfully, we do now. We have the atypical antipsychotics like Zyprexa and Abilify. We also have lithium and electroconvulsive therapy. So back to our discussion of benefit versus risk. It's always what you absolutely need. What is worth it? So if you're going to die without the prednisone, but the prednisone is causing side effects that are so bad, you might need to take this medicine, and then it's worth it. All medicines in every treatment, including water, has a side effect. So it's always figuring out what the balance of that is and if it's worth it. So in light of that, the doctors should monitor you. I showed this exact same slide last week. But no matter what, if you have a doctor or you are a doctor, we should be asked about these side effects at every appointment. We should tell our doctor if anything is happening that you're not used to. If your mood is getting out of control or you're feeling suicidal, you need to tell your doctor, because those medicines can help. They can bring you back to feeling more like yourself. And it's really important. So you're worth it. It's worth getting help. And so find that help. Finally, I created this dietary supplement, and it has several ingredients that can help keep a steady mood and help you sleep more restfully at night. I really struggled with sleeplessness when I was on prednisone. And so I created this so that when I have to go back on prednisone, I've got this to fall back on. That not only is it helping me feel calmer and more like myself, but it's also giving back the nutrients that prednisone is stealing in addition to that melatonin. And so I would encourage you to check it out at nutrinize.com.
Can prednisone cause anxiety? Is that a thing? I'm Dr. Megan, the prednisone pharmacist, and I'm here to discuss some science that backs up the assertion that prednisone does cause anxiety. But the problem is there's just not a lot of great evidence right now of how to cope. So I want to go through the evidence that it is a thing first, and then we'll talk about some ideas for what we can do. So this is an email I get basically once a month or once a week, essentially. Substitute any name here, female, male, it's always the same story. And it's something like this. Hi, I took prednisone like twice. In this case, this person was stung by a wasp and took 60 milligrams of prednisone along with using my EpiPen. So just one little wasp sting. Afterwards, I took 20 milligrams of prednisone a few times, maybe 3 times total. Since then, I've been dealing with extreme anxiety and daily panic attacks. That is like the most common symptom right there. I've barely been able to go to work and take care of my kids. Even if I make it through the day, it comes roaring back around 6 p.m. My doctor gave me a few Ativan pills, also called Xanax, but they only stop it for a moment. Any ideas about what I can try next? I'm starting to feel pretty desperate to feel like myself again. No kidding. So I hear that exact same story. Substitute wasp sting for poison ivy for asthma attack. It's the same thing. I only took a few prednisone, but I'm having horrible anxiety. What do I do? So first of all, I want to say you're not alone. All right. You're not making this up. You're not suddenly going crazy. This is legitimate. This is caused by the prednisone. Prednisone legitimately causes mental changes. And so I found a brand new study that was just published this last year, and it tested people on their first time ever taking prednisone. And it started out at 40 milligrams, and this is for a condition called irritable bowel disease, IBD. And they would start out at 40 milligrams. And before they would take the 40 milligrams, they would do a questionnaire to see how their mania symptoms were and how their depression symptoms were. And for all intents and purposes, I consider this kind of anxiety to be like an extreme form of like a complication of mania. So they start out at the 40 milligrams, and then they drop by 5 milligrams each week until they're off. And then they would test them for their mood changes as time went by. So after their very first exposure to prednisone, do you want to guess what percentage of these people had mood changes? 49%. Nearly half of the people who took prednisone had mood changes. And those were only 2 types of mood changes they were even looking for. I'd say there's a lot more that they could have looked for, but they wanted to keep it simple and measurable using standardized tests that are used in many other conditions to diagnose either mania or depression. And so essentially we discover that half of people who take prednisone are going to have some sort of mood change. So what did they see? They saw that mania, specifically hypomania, like a mild form of mania, happened more often than anything else. And what in the world does that even mean? So a way to describe mania is like feeling abnormally good and there's not a reason for it. Like you didn't just win the lottery, you just took prednisone. And so you have more energy than normal. You might have a heightened mood, decreased need for sleep. You might be extra irritable, potentially. That's what hypomania is. I had a friend who took it, and he was like this homebound old guy who rarely left his living room chair. And after he took prednisone, he was like, this is great. And he was out there power washing their trailer, their camper trailer, and just like, this is so awesome. I've never felt this good in my whole life. But here's the thing. It doesn't last. Don't think that you're going to keep feeling that way, because you're not. It doesn't last. They showed that after they got 40 milligrams and they dropped, they were less likely to be feeling that mania. And then once they were all the way off, almost nobody felt that way anymore. So the important thing to know here is the higher the dose, the more likely people are to have mood changes while on prednisone. And so that means that most people, when they get back down and they're off of prednisone, most people it goes away. So that's really great news for most people, is that these mood changes are associated with the drug. It's not you, it's the drug causing it. And for most people, it goes away when your treatment is done. Unfortunately, there are other people who their treatment is never done. And so that's not very reassuring. Or who the mood changes don't go away very quickly, even after stopping. And that's where it gets really hard. And that's where there's just not a lot of great scientific research telling us what to do. And so I've created several articles to help you know how to cope with this situation, several videos. So just click the link below and it'll take you to that next video. And you'll be able to see what possibilities I suggest for you. So just click the link below and you will find out what I recommend. And you can feel that you're not alone. You're not the only person feeling this way. Prednisone that can cause anxiety, and it causes mood changes in about 50% of people who take it. So remember, it's not you, it's the drug.
Can prednisone make you feel crazy? Can taking steroids cause psychosis? Hi, I'm Dr. Megan, your prednisone pharmacist. I'm here because I received a phone call today from someone wondering if what they were feeling was from the prednisone or was it something else. So this person was given 5 days of prednisone. First, they were told to take 40 milligrams every day for 5 days. And instead of doing so, they took prednisone 40 milligrams for 3 days and then dropped down to 30 for 2 days and then did 20 for 1 day. So ended up getting 6 days of treatment. After a few days, felt totally unlike themselves. Terrible insomnia, couldn't sleep at all. Reports that for the last 10 days has hardly gotten any sleep. Gets jittery, shaky, and has had high blood pressure and is just feeling awful. He reports that he's got memory issues, a little bit of brain fog, and is desperate for help. If you're feeling any of those symptoms, then I am so sorry. It is just so hard and unpredictable. This is a side effect of prednisone that is unpredictable, and yet it is legitimately associated with steroids like prednisone. So what is this? Steroid psychosis, or corticosteroid induced psychosis, or prednisone psychosis, however you want to refer to it, is a side effect that can happen, and it actually has a legitimate diagnosis code in the Diagnostic and Statistical Manual number 5. That code is actually, to be precise, F19.251. And it's called Other Psychoactive Substance Dependence with Psychoactive Substance-Induced Psychotic Disorder with Hallucinations. What a great diagnosis, right? And this steroid psychosis is life-changing for people. Being otherwise healthy, but needing just a few days of a steroid, whether it's an injection, it's usually a pill that people are taking. It's usually prednisone, but it could be methylprednisolone, which is Medrol. It could be hydrocortisone, could be dexamethasone. It's usually prednisone, though, that people are taking. And it's most common after 3 to 4 days of treatment. And then the diagnosis code specifically says, first, the patient must have at least delusions or hallucinations after exposure to a medication capable of producing these symptoms. So you can't have been having symptoms and then take the steroid and then they get worse. It has to be like you were otherwise healthy and then you took the steroid and then you're suddenly having symptoms. So it has to be timely, like there has to be a temporal relation between the symptoms and having taken the drug first. Okay, so the drug has to be first. Second, this disturbance cannot be better explained by a non-medication induced psychotic disorder, and it does not occur exclusively during the course of a delirium. So what that one is saying is it can't be caused by something else. Okay, it can't be caused by high blood sugar or diabetes or kidney problems or some other thing that's causing the balance in your body to be out of whack. It has to be, the only other option left is that you were exposed to a drug. So if you are concerned that this is the problem you're having, then your doctor needs to rule out all other possibilities first before deciding that this is the only option left. So that was number 2. And number 3, finally, it must cause clinically significant distress or functional impairment. So basically, it can't just be the hypomania that people commonly experience with prednisone. That's where you feel really good, just like life is great. I've got plenty of energy. I can do anything. My neighbor, he said, I was able to power wash my my camper trailer. He's like in his 80s and he was power washing his camper trailer. Like, this is great. I've got so much energy and I'm back to, being young again. That's hypomania. This has to cause distress or functional impairment. You have to be unable to function. Okay. So it's hypomania is where it's like difference, but it's not causing a problem. Whereas mania, psychosis, these other mental illness complications of prednisone, they have to cause a problem in your life. Okay. So then what are the possible complications to go along with steroid psychosis?
So the complications could be depression. So you might have this brain fog and fatigue and anxiety and stuff, but there's depression that goes along with it, can happen. Hypomania, I've already mentioned. Mania is where you're really feeling disconnected and excited, possibly having pressure to do something. Psychotic disorders is where you're feeling like completely disconnected from reality in some way, whether you're believing something that isn't true. Like, for example, one woman in this case series that the scientific article, she believed she was pregnant and they had done pregnancy tests. She was not actually factually pregnant. And so it's believing things that aren't true, being suspicious of people, paranoid delusions, those are possible. Complications, cognitive impairment. So just brain fog, just like I can't remember well, delirium, just kind of that feverish, like I'm not quite there. And dementia is where there's full-blown memory loss, inability to quite remember what's going on, what's happened recently or even in the distant past. So those are complications that can happen. Then when does this happen? When is it most likely to happen? When a person is taking steroids. And according to the study, it says steroid psychosis happens shortly after administering steroids, typically a medium of 3 to 4 days, but it can occur at any time during therapy or even after treatment discontinuation. So what that's saying is it's usually within the first few days of treatment, but it can happen anytime. It could happen after a year. It could happen after you've taken it successfully in the past, taken it, tapered off, years go by, taking it, taping off, years go by, and then suddenly it's happening this time. There's no way to like definitely predict that it's going to happen unless you've had it happen in the past. Then it is somewhat predictive. And then it can happen even after you stop taking the steroids. You could have stopped taking the prednisone 5 days ago and then suddenly have these symptoms. That is possible as well. So then it's happening. I know it's happening. I know when it's happening. What can I do about it? Right? That's your next question. And so the treatment, the number one most effective treatment is to taper off the steroids or discontinue their use. Otherwise, the quickest taper that you can tolerate, if you're taking it for a life-threatening condition, then there's a definite risk balance question you and your doctor and your team have to go through. I am not capable of making that kind of decision on your behalf. I am not your doctor. And you have to be working with your doctor closely to determine whether or not to go off steroids, to go off prednisone. That is 100% a conversation you have to have with your doctor, because going off suddenly can be fatal. So you can't just stop taking it without consulting a medical authority who knows your situation. Okay. So that's the most effective treatment under your doctor's care. Okay. Second is giving an antipsychotic medication. This is a steroid psychosis situation. So an antipsychotic makes sense. And there are different kinds of antipsychotics. They recommend that there's the second generation antipsychotics like haloperidol. And then there's, that was a first generation antipsychotic is haloperidol. And then the second generation antipsychotics are risperidone, like Risperdal, olanzapine, and quetiapine. So those are second generation antipsychotics that can help with the psychosis. And then if the symptoms are more into the mania side, then lithium can help. And if the symptoms are more depressive, then SSRI, which is selective serotonin reuptake inhibitors, can help. So those are possible treatments. There are other medications that can support other symptoms. I don't want to go deep into that because that's really what your doctor, your mental health team will need. If you are going through this, this is a very serious complication of taking steroids. And I encourage you to get help from a qualified mental health professional. That means possibly going to the emergency room. They may not be able to support you there. If not, checking yourself into a hospital, into a psych unit, behavioral health unit. People who have these symptoms, are also at risk for suicide. And so if you are having this, I urge you to get the help you need. I do not want anyone suffering this. I've received emails and phone calls from people who have lost family members to suicide after taking prednisone. And I never want that to happen. It is treatable. We can get you the help you need. You do not need to suffer. Call 211 in the United States. They can help you. There are a lot of other resources I'm going to link to below that you can go to. There are support phone calls, there are support websites that you can use to get you through this hard time. And the most important thing I want you to understand is that the first diagnosis qualification was it was because of the drug, and then you had the symptoms. Okay. It's not you. It's the drug causing this. Okay. It's a side effect. You don't need to feel like you're going crazy. You're not. It's a side effect of a drug, and you need to get the treatment for this side effect. It's terrible that taking a life-saving medication like prednisone can cause such a life-threatening complication, such as steroid psychosis. But that's the paradox of prednisone, that the good comes with the bad. It's a two-edged sword. And so I urge you to get the help you need. And if you need support in the form of other people who've gone through this, I have several prednisone warriors who've reached out to me, told me their story. And in fact, I've interviewed the author of a book about this topic called Steroids Stole My Summer. And you should watch that. It's a fantastic interview, and what he recommends in that book is fantastic. So he can dive deeper into understanding what it feels like. So check out those resources and get the help you need. I shared this meme on Facebook and on Instagram. It shows Medusa the Gorgon with her snake head saying, "Beware, I'm on prednisone." And I said that taking prednisone is even worse than the rage Medusa must feel for being banished and cursed with the death glare and the evil snake head. And somebody said that I was wrong, that Roid rage from prednisone isn't real. I couldn't believe it. In fact, not only did they say it's not real, but that it's actually, any mood changes while you're on steroids are actually because you eat too much. Yeah, that's what they said. I couldn't believe it. And so I had to come on now to dismiss these myths and prove it with scientific research that I've been studying for years, because I don't want anyone out there to be taking prednisone or any other steroid and feel like this and be dismissed and told that it's because you're eating too much. So here are my 7 myths busted about prednisone mood changes, specifically proving that Roid rage is real. And who am I anyway? I'm Dr. Megan, your prednisone pharmacist. I am here to help you not just survive prednisone, but thrive while on prednisone. So here I'm going to get straight to the good stuff. So this poster, who claims to be an expert about these things, said, "Roid rage is a term used to describe what happens to bodybuilders when they take anabolic steroids." Now, I agree with that. That's true. Anabolic steroids raise testosterone, causing intense anger. Glucocorticoid steroids do not have that effect. So they're talking about anabolic, which is like the bodybuilder, like people who abuse steroids so they can win races. Do that. That's true. Glucocorticoids do not have that effect. Not true. When hydrocortisone or prednisone doses are too high, a person tends to eat too much and have feelings of sadness and depression. Anyone experiencing rage while taking glucocorticoid steroids has another hormone imbalance and should be tested for testosterone levels.
your meme is misleading people who don't understand steroids and making it harder for patients to navigate the world. So false. They started with truth. They started with a little bit of truth, and that's anabolic steroids are not prednisone. Prednisone is a glucocorticoid. Anabolic steroids are like testosterone, male hormones that boost your muscles. Prednisone takes away your muscles, saves lives. And so I said, I agree that the term roid rage is confusing. I'm sorry if it seems that it is making harder for patients to navigate the world. However, please understand that my intention is not to misinform. Rather, it is to make the time suffering while on steroids as pleasant as possible. One of the ways I've found to make life pleasant is through humor. Memes such as this one, which I did not create, I found online, help us accept our conditions and the situation we find ourselves in, because we realize we aren't alone in our suffering. I have to respectfully disagree that prednisone and other glucocorticoids don't cause rage as well. There is a multitude of scientific literature documenting the dramatic and sometimes terrible mood changes from prednisone. And then I also said, I receive phone calls at least once a week with people who had no previous mental illness and who are not suffering from excessive hunger, who are brand new to prednisone and are having extremely debilitating and miserable side effects. They are having anxiety that doesn't allow them to even get off their bed. They can't even handle watching TV. They can't be around their children. They're totally buzzed and incapable of functioning because of the mental changes that prednisone is causing in them. It has absolutely nothing to do with food. So here is the evidence. First is an article published in the Annals of New York Academy of Sciences called Effects of Glucocorticoids on Mood, Memory, and the Hippocampus. And this shows the first fact. First fact is that the most common mood changes from prednisone are mania. Fancy word for rage. Roid rage. I know it's attributed to anabolic steroids, but it happens with prednisone too, with glucocorticoids as well. Mania is the most common mood side effect. That means people are having serious, miserable feelings. And it says hypomania and mania are the most common mood changes during acute corticosteroid therapy, although depression has also been reported. Those are the top ones, mania and hypomania, like miniature mania. The second truth that we find out in here, this fact, is that both symptoms and the treatment response of the psychiatric mood changes while on prednisone and other steroids are similar to those of bipolar disorder. You know what bipolar disorder is? It's when you're high and low and high and low and high and low. What is that high? That high is mania, rage, crazy, like bouncing off the walls, inability to focus. Psychosis is what it's up at that high peak. Not for everybody, but those are possible features that's characteristic of roid rage. The third fact is that the mood changes are reversible when stopped. It specifically says corticosteroid-induced mood and cognitive alterations have been shown to be reversible with dose reduction or discontinuation of treatment. That means that it has absolutely nothing to do with your appetite. It has everything to do with the fact that you have this little bottle with pills in it and you took them and then you stop taking them and the side effects go away. No bearing on whether you gained weight, no bearing on your appetite at all, because fact number 4 is found in the
also in the Annals of the New York Academy of the Sciences, and it's called Glucocorticoids, Mood, Memory, and Mechanisms. And this one teaches us that high levels of cortisol in the blood is related to psychiatric symptoms. So some people have psychiatric illnesses because their body is naturally making too much cortisol. It's as if they were taking a pill. Their body's just secreting too much cortisol. And they're having psychiatric symptoms. Is it because they're having so much stress from those psychiatric illness, or is the psychiatric illness causing high levels of cortisol? Nobody knows, but they're related. So this has, again, nothing to do with appetite. Number 5 fact, myth busting, is that mood changes are very common. This is found in the Mayo Clinic proceedings. Mayo Clinic being one of the foremost medical institutions in the world. And they have this article called Glucocorticoids, Mood, Memory, and Mechanisms. Oops, that was the next one. And Mayo Clinic proceedings. It shows that psychiatric disturbances are common and include mania. Corticosteroid-induced psychiatric disturbances are common and include mania, depression, psychotic or mixed affective states, cognitive deficits, and minor psychiatric disturbances, which include irritability, insomnia, anxiety, and labile mood. Do you know what all of that is kind of saying in scientific ease? It's saying prednisone makes your mood change, makes you irritable, makes you rage, makes you miserable to be around. There's a reason there are memes out there that I didn't create, other people did, that talk about how your family will want to pack up and take a 6-month vacation from you while you're on prednisone because it changes your mood. I didn't make this up. My meme, which isn't even my meme, didn't make this up. This article goes on to say mild symptoms, and these are mild, okay? Because there's severe ones. These are the mild ones. The most frequently identified mild symptoms include agitation, anxiety, distractibility, fear, hypomania, indifference, insomnia, irritability, lethargy, labile mood, pressured speech, restlessness, and tearfulness. Does that sound like a very pleasant person to be around? No, it's not. This is real. This is documented. I've already shown you 4 articles. Would you like a 5th? Because I have one. This one is from Cambridge. Another one of the highest level of scientific rigor in the world, Cambridge University, British Journal of Psychiatry, says the mood changes are not from, this is my proving that the mood changes are not from testosterone. It is instead the HPA axis dysregulation. The HPA axis meaning the hypothalamic, pituitary, and adrenal glands, the cycle that your body goes through to make cortisol. Okay? A dysfunction in glucocorticoid receptors is integral to the HPA abnormalities of mood disorders. Antidepressant and mood stabilizing drugs can upregulate glucocorticoid receptors, restoring glucocorticoid function. This is showing testosterone has nothing to do with mood symptoms while on prednisone. It is not the testosterone. It is not the male hormones. It is not the sex hormones. It is not androgens. Any of those terms you want to call it have nothing to do with the mood changes while on prednisone. It is the dysregulation, the messed up cycle that you have going on. It's supposed to be connecting your brain to your the pituitary to your adrenal gland right above your kidneys. And it's being messed with while you're taking prednisone. It's interfering. It's stopping that cycle from happening. And that's what's causing the mood changes. Not testosterone. Not androgens. I've shown you 5 scientific articles that prove that it's not testosterone and it is not your appetite. These have nothing to do with mood changes. So, my conclusion to this poster said,
Dismissing mood changes as a consequence of eating too much is incredibly harmful. It delegitimizes the true suffering people have from these terrible mood changes. I receive a phone call at least once a week from someone previously healthy who suddenly has disabling mood changes, from anxiety, depression to psychosis. It has absolutely no relationship to their diet or food intake. In fact, they are usually just starting steroid use and haven't even had the appetite changes hit them yet. It is just because of their steroid intake. So, if somebody is dismissing your mood changes as it's all your fault, you're a terrible person, I'm going to divorce you, I'm going to fire you, whatever consequence you are suffering with right now, I am sorry. And for those around you, I am sorry. Prednisone and other glucocorticoids are miraculous drugs, but they come at a huge cost, and this is one of them. These mood changes are disabling, real, and not caused by you. They are caused by the drug. They are caused by the dysregulation of your systems from taking the drug. And you're taking the drug probably because there's something terrible going on. For me, I had to take the drug because I was otherwise going to bleed to death. It saved my life. I'm here to tell you, like, the other side of the story. I've lost my moon face. My moods are my own now. There is recovery. There is another side to this. And so if you are one of those suffering mood changes after taking prednisone, you can share this with your family. You can share this with your boss. You can share this with your friends, whoever is being affected around you, to say, look, it's real and it's not my fault and I'm sorry. And the one thing I need from you right now is understanding. Because when we can see that it's not you, it's the drug, then we can have compassion. Then we can have love. We can have understanding, forgiveness, and we can heal those broken relationships caused by taking a life-saving drug. That's what I want for you today, is to share this with your family, friends, associates who are being affected by you taking prednisone and other steroids, so that they can understand, that they can comprehend that this is real and it's not your fault. And you will heal. It takes time. And you might need to take other medications to help you get through this rough time while you're on prednisone. But they can help. There is hope. That's the thing people are so lacking these days. There is hope.
Can prednisone shrink your brain? Is that possible? I mean, like, it was this size before you took prednisone and now it's this size. Is that possible? Well, a study just came out a few weeks ago and it shows that actually, yes. Cut to the chase here. Prednisone can shrink your brain. Wow. Wow. I mean, this is stunning. They had seen little pieces of information that thought maybe that could be the case, but now they actually have proof that prednisone can shrink your brain. Now, it's not actually causal information because this is an observational study. That means it's looking back in time. So they have a database in the United Kingdom called the UK Biobank, and they found people who were taking prednisone, or in the UK it's usually prednisolone, or they were having it injected. So either a pill or an injection. And then they also found another group of people who were using the inhaled steroids. For example, if they had asthma or COPD, they might need to use an inhaled puffer to get their steroids. And they saw those two groups and compared them to thousands of other people who were in this database who had never taken steroids during the study. So they were looking back at time to see, okay, if they had prednisolone or inhaled, how do they compare to all of the other people? And what they found is that all of these other people, their brain tests, their ability to play matching games, to see how things, like they did tests of their cognitive abilities. And the people who weren't taking prednisone, they called controls. Okay. So the controls versus the users. And they called these ones the systemic users. That means people who are using it either by pill or by injection, or inhaled users. And they found the following results, and they are kind of stunning. So this is what they found, that with the 3 tests that they did, the 3 cognitive tests, the people who swallowed prednisone, they did the worst on a test called a symbol digit substitution task compared with people who were in the control group. And then they did a test to see, was their mood actually different? Like if we measured their brain sizes, but what about the mood? And they found that people who were using the systemic, either the pill or the injection, that they showed more depression, disinterest, tenseness or restlessness, and tiredness or lethargy. So it was significantly worse in the people who used prednisone. And then they thought, well, does inhaled steroids also cause mood changes? And they found that yes, only one of those things changed though, and that was the tiredness or lethargy was worse. And so what exactly were the mood changes that not mood changes, brain changes that they saw? And this is what they found. They said that the prednisolone use affected the white matter microstructure. What does that mean? So in your brain, we have our little brain here. It's red, and normally it would actually be gray. The outside that you would see if you cracked open somebody's skull would be gray. And then inside of that would be white. And so the outside is gray and the inside is white. Actually, if you ripped this open, it would be white too. So the white matter is the inside. That's the part that's connecting all of the brain together. The gray matter is on the outside and it's communicating with everything out there. So it was the white matter microstructure, like the little tiny, tiny pieces, so specifically probably the oligodendrocytes, were smaller. There was less volume in prednisone users versus non-users. And they found that it was likely dose dependent and duration dependent. What does that mean? It means that probably the higher the dose and the longer time you take it, the worse it is. But they don't actually know that yet, but it looks like it. And so they found that this finding of a smaller brain, like a shrunken brain, remarkable, they said, remarkable, given the common neuropsychiatric side effects, that maybe this is the answer. Like maybe this is why people who are taking prednisone don't feel like themselves. Their brains are actually smaller than otherwise. And they found, in addition to that, they found global cerebral atrophy and cortical thinning and volumetric changes. So what in the world were those big words? So this is the cerebrum, and they're saying the whole thing, not just like one spot, but like the entire thing is smaller than it otherwise would be. And the cortical thinning, so like the cortex was thinner. And then the volumetric, so that's saying like how much space it takes up, like the milliliters, was smaller. So that was global. It was the entire brain, not just one spot on the brain, for people who were taking steroids as opposed to people who weren't. But they found one thing that was interesting, that both the inhaled and the pill caused white matter, the inside integrity changes. But for some reason, while the pill was causing decreased volumes, inhaled caused some increased volumes where the pill never ever did. So some parts of the brain were larger than normal for people who inhaled it. So what do we do now? Like, what's What's the punchline here? How do we move on from here? So this leaves us with a lot of questions, right? Like, does it come back if I stop taking prednisone? Does my shrunken brain unshrink, right? We don't know. This is just the very first study to show anything. So does it come back? Does the dose matter? I mean, they think it does, but they didn't actually have proof that it does. Does the duration matter? Do these brain volume changes actually correlate to the neuropsychiatric side effects? It seems like it, because they found more depression, disinterest, tenseness, and lethargy in people who were taking prednisone. But were they the same people? It was hard to tell. And then another thing that they weren't able to figure out was the pill or the injected causing worse issues? Because the way they name the drugs in the database, they're both prednisolone. They're prednisolone pill and prednisolone injection. They couldn't tell the difference. It was just the chemical name of it, not prednisolone injection. So they don't know for sure if it is the fact that you're taking a pill or you're getting it injected in your arm. They don't know. So there's lots of questions still. We don't know the answer. So if this is your first time finding me, or you've never actually taken your prednisone pill and you're thinking, should I take it or not? Consider your brain. Do you want it to shrink? Do you want to potentially go through those side effects? It's a real tough question. So you've got to figure out whether that is right for you, and that only can be answered between you and your doctor. You have to be able to know that there are many risks, including brain shrinkage, and there are amazing benefits too. It saved my life. I'm here today because of prednisone. Like, I didn't bleed to death because prednisone exists. So you have to figure out, do those benefits outweigh the risks? And if you need to know more about what those risks are, you can download my prednisone checklist, and it'll help you do everything in your power, everything in your control to make those benefits outweigh the risks for you, to figure out exactly the top 15 concerns of people on prednisone and what you can do about it, plus 25 tips of how to cope while on prednisone. So you can download that by clicking the link below.
Will my moon face ever go away? Is it permanent? Am I always going to look like this? Hi, I'm Dr. Megan, Prednisone Pharmacist, and I wanted to share with you which side effects of prednisone are permanent, irreversible. There's nothing you can do about it once it happens to you, and which ones are possibly reversible. Cross your fingers, it does go away for most people. So let's talk about some of them. Well, first of all, let's talk about moon face, because that is the most obvious physical manifestation that somebody is taking prednisone. Moon face is that puffy fat redistribution where you lose your jawline, you lose your smile lines, and you get this big round face. I'm grateful to announce that I don't have it now because I'm not taking prednisone. Therefore, moon face is reversible. It does go away. But what about other side effects? So some can cause damage that is irreversible. Some can just do things that seem miserable that eventually might go away. So starting at the top, we'll talk about hair. So a lot of people are concerned about hair loss. And when I took prednisone, my hair was just fine until I stopped taking it. 3 months later, I lost a third of my hair. And I normally have very thick hair. And it got thin, like back to a normal person's amount of hair. But for me, it was a real big surprise to see all of this hair coming out in brushes. And that lasted for several months. And then I noticed it started growing back. So that was like in August. And then I noticed it started growing back in about January. And I could see a cute little curl in March. So it is reversible, but it takes a long time for hair to grow, right? So now moving down from hair to eyes. So there are two main side effects on your eyes. And the first one is glaucoma. Glaucoma is the extra pressure in your eyeball that can lead to damage to your retina and lead to blindness if you don't treat it. And hopefully it goes away, but it doesn't always go away. So you definitely want to be working with an eye doctor closely while on prednisone, especially if you're using steroid eye drops. That is when it's the highest risk. That's the first eye side effect. And the second one is cataracts. Now, cataracts is where there's a clouding of your vision because there's damage. It's called a cataract on your lens. It's kind of blocking it, your ability to see. And there's a specific kind of cataract, subcapsular something, that your doctor would recognize. Oh, you must be taking prednisone. It only comes from prednisone, that type of cataract. And so definitely be getting your eyes checked. And this is irreversible. Like, there is nothing you can do about that cataract with your natural lenses in your eyes. Like, it will not just go away once you stop taking prednisone. Luckily, we live in the day and age where you can have cataract surgery, remove the lens, and replace the lens with a replacement lens, which hopefully works. But, my grandma tried to do that and it didn't take, and she went blind. So hopefully it's reversible. And then moving down from the eyes to your heart. So prednisone is pretty hard on your heart. It is trying to help you, like, prednisone is mimicking a hormone called cortisol, Mother Nature's fight or flight survival hormone. And it's trying to give you the ability to run away from a really bad situation, whether it's a tiger, a famine, or a war. And so it's trying to help you have the amount of blood pressure needed to run really fast. But you're not running away from any of those things. So you'll have high blood pressure. I normally have quite low blood pressure, and my doctors are always, or at least the nurses are always concerned, hey, that's pretty low. Is that normal? Yeah, that's my normal. But when I was on prednisone, it was high. And I'm an otherwise normal, healthy person. So if you have other risk factors for high blood pressure, it's more likely that it will be high. And that high blood pressure itself does usually go back to normal, whatever your normal was before prednisone. But prednisone leads to damage to the cardiovascular system. You have a 2.5 times increased risk of cardiovascular damage compared to someone who never takes prednisone. And so that damage doesn't go away. Like, if there's something happens to your valves, or if you start getting an arrhythmia or something like that, that damage is permanent. It does not go away. So if there's any progression in your cardiovascular disease, that progression is permanent, but the heart blood pressure does reverse. So that's the good news about that one. Now moving down to the adrenal glands. So this is right on top of your kidneys, right below your ribs. And the adrenal gland is what normally produces our stress hormone cortisol, which is what I just told you is what prednisone is mimicking. So when we take prednisone, we're telling the whole system that makes cortisol, called the HPA axis, to turn off. We're like putting a stop to that whole system. And so for most people, the adrenal axis does slowly start turning like a really big, heavy train. The train starts going. And then it's back to normal for most people. But for a small percentage of people, and there are no great studies proving how much it is, whether it's 1%, 0.1%, or 10%, I don't know. For some people, the train never starts going. The adrenal system is basically broken, and that leads to adrenal insufficiency. And so while you might have started taking prednisone for an autoimmune disease or for asthma or for COPD or something, arthritis, whatever it is, it may lead to damage to your adrenal system where it never starts up again. Most people it does. There are some people that it never does. And so you might have started out like at 20 milligrams of prednisone every day for a week or whatever. And then you slowly taper off and you try to get off and you can't get off because now you are dependent on prednisone to save your life. And if you go cold turkey thinking, oh, I'm fine, you won't have the reserves to deal with catastrophic stress, getting in a car accident, having a heart attack. You won't be able to deal with that. And it can lead to death.
So you need to always taper off carefully and work with your doctor closely to make sure that your adrenal system does return. And I have a whole bunch of videos all about withdrawal and tapering and strategies to help you with that. All right, now moving down to your hip. The hip joint is a likely place for damage from prednisone. There's two types of damage that can happen. The first one is called osteonecrosis. And osteonecrosis, meaning death, osteo meaning bone. So bone death. That ball joint that inserts into your hip socket, that ball, the top of it can die. And the only solution is a hip replacement to replace the entire ball into that socket. And that can even happen in young people, even in children, if they're taking prednisone. And so that damage is irreversible. And luckily we live in a time where there are replacement sockets, bones, replacement joints, so that you can still have a quality of life. The other one is osteoporosis. And that's not just this area. That's all of the bones in the body. They're the worst places for it to happen are in your spine, leading to loss of height, in your hip, leading to a broken hip, and just in general, leading to broken bones. And they've done studies showing that if somebody gets a broken hip, they have something like a 50% chance of death within a year of breaking a hip. So this is a terrible outcome that we do not want to do. And it's happening because prednisone is stealing calcium and vitamin D and magnesium and other really essential nutrients from your bones, and it's weakening them. And so we want to do whatever we can to prevent that weakness. And then finally, weight gain. So along with the moon face and the redistribution of fat from your arms to your face, there is weight gain in your belly area and just throughout the body that you would hope is reversible, like pregnancy weight gain. There's a 7-pound baby, you instantly lost 7 pounds, and some of it is reversible. So the water weight gain, like what's causing the blood pressure to go higher, is partly there's more fluid. The body is producing more fluid, it's holding on to more sodium in the kidneys. And once the prednisone is down, that often is reversible. There's a fluid loss and the blood pressure goes down, the water weight goes down. But there's also the fat weight gain. And that is just weight gain that you have to work to lose, like any other weight gain. And so it's not like it is reversible, but it doesn't just go away after you take prednisone. So again, that's another thing that we can be doing something about while taking prednisone. And whether it's your eyes, whether it's your bones, your weight, your blood pressure, your height, or any other factor that is going to be affected by taking prednisone, there are possible things that you can do about it. And I outline all of those in my prednisone checklist. I don't want you to have to suffer these permanent, irreversible side effects. I want you to feel confident that you're doing everything in your power to counteract side effects, to minimize the damage. And so that's why I have my prednisone checklist. All you have to do is click the link below to download it now. And it has my best tips that are evidence-based from the doctors who prescribe prednisone the most and other scientific studies so that you can do whatever you possibly can to minimize the damage, to be following up with the right doctors at the right time so that you can stay as healthy as possible while taking prednisone. Just click the link below to download it now.
Now that you understand why prednisone is causing mood changes and what those other mental health effects are, it's time to talk about what you can do to overcome those challenges. How to cope with the mood changes from prednisone. In part 2 of this marathon, I'll share actionable strategies to help you manage mood swings, anxiety, and depression, and other mood side effects while on prednisone. Plus, you'll hear powerful personal stories from prednisone warriors, people who've experienced these side effects firsthand, and how they made it through. You can find part 2 linked in the description or the playlist, and I highly recommend watching it as soon as you can. It's packed with tools and inspiration to help you feel more in control of your mind and emotions while on prednisone. Thank you for joining me today. I'll see you in part 2. Signing off as Dr. Megan, your prednisone pharmacist.